I'm Felicity Thomas. I'm a Senior Research Fellow in the Medical School and Co-Director of the World Health Organization Collaborating Centre on Culture and Health in the College of Humanities. I'm currently leading a team of researchers on the Destress study. This is concerned with understanding how people in low-income communities experience and respond to stress and the effectiveness of treatment and support options that are currently available to them. The British government has said it wants to provide effective mental health support for anyone who needs it. However, current health strategies tend to frame mental distress as a psychological or pathological problem that lies within the individual. Now, this does two things. First, it suggests that distress can somehow be corrected through some form of treatment. And secondly, it also masks some of the issues that are actually at the root cause of the problem or of the stress. So things like unemployment, low pay, poor housing, social isolation, and increasingly the stresses caused by recent welfare reforms. Alongside this, we're seeing increasing rhetoric, or what we're calling narrative, in government policy, through service providers like job centres, and in the media, so in papers and television programmes like Benefits Street and Benefits Britain, which reinforce this idea that people are responsible and accountable for their own actions and circumstances, and that if you're struggling, it's your own fault. What we're trying to understand is how this kind of rhetoric might be influencing the high uptake of antidepressants in low-income communities, and how the use of antidepressants is actually then impacting on people's health and well-being. So we're aiming to increase debate and understanding about the ethics and the implications of antidepressant medication prescribing and use in low-income communities when the main causes of the stress that people are experiencing does not necessarily have a medical basis. In terms of approaches and methods, well, understandings of mental health tend to be based on what happens within clinical interactions. And what we're doing within this study is looking beyond the surgery to understand how stress is bound up with everyday challenges and realities that people face within their broader lives. So in terms of impact, at the heart of the project is a commitment to ensure that residents in the study sites are key collaborators in the project and that their voices and lived experiences can effectively inform policy and practice. For example, we're going to be working alongside residents to develop guidelines on good practice for health professionals who work in low-income communities. And we're also hoping to feed project findings into local health plans, to clinical commissioning groups, and into the work of civil society organisations.